In the year 1944, a young man of 24 years found himself in the office of German neurologist Joachim Bodemer. A gunshot wound to the head had damaged the visual processing area of his brain, leading to complete blindness that lasted for weeks. As he gradually regained his sight, he struggled with identifying colors and shapes. Bodemer noticed that while the patient could see faces, he couldn't identify who they belonged to. To him, faces appeared alike, indistinguishable. He couldn't discern whether a face was male or female, except through external features like hair and clothing. This case was among those Bodemer reported in 1947, using for the first time the term prosopagnosia, derived from the Greek words prosop meaning face and agnosia meaning ignorance or non-recognition. So what exactly is face blindness, also known as prosopagnosia? It is a neurological disorder that results in the inability to recognize and distinguish faces. It is not related to memory loss, visual problems, or learning disabilities. Approximately 2.5% of the population is affected by it. There are two types: acquired prosopagnosia, which can occur due to a stroke, traumatic brain injury, or any degenerative neurological disease like Alzheimer's or dementia. The other is developmental prosopagnosia, a congenital disorder that a child is born with, due to the inheritance of certain genes or a genetic mutation causing the disorder. Sometimes this disorder manifests in individuals with autism, Asperger's syndrome, Williams syndrome, and Turner syndrome, possibly contributing to their social communication difficulties. The challenges faced by people with this disorder are varied. They may struggle to recognize familiar faces of relatives, friends, and even their spouse and children. They may have difficulties recognizing unfamiliar faces, their own faces in the mirror, or distinguishing faces from objects. In severe cases, they may struggle to distinguish animals or cars, recognize facial expressions, determine age and gender, or recognize people in uniform. This can lead to confusion when watching films or TV shows, or getting lost in crowded places. Children may face difficulties in forming friendships and recognizing their parents outside home, often feeling isolated at school. The disorder has a negative impact on those affected, leading to social isolation, depression, difficulties in forming personal relationships, difficulties at work, avoidance of social events and meeting new people, and reluctance to greet individuals by their names. Diagnosis can be challenging due to the lack of a clear line between face blindness and average face recognition abilities. Tests are available to ascertain the health of vision and rule out any issues, as well as tests to rule out any cognitive impairment, memory tests, and object recognition tests to rule out any form of blindness. Diagnostic tests such as CT scans, brain mapping, MRI scans, and specific face recognition tests like the Benton test, where the individual is asked to choose a face among 6 to match with a given face, are also used. Till date, there is no cure for face blindness. However, if it is due to a treatable cause, whether it be medical or surgical, that would be an appropriate solution. For others, they are trained to adapt to this disorder using various cues to identify individuals, like the speaker's voice, clothing, hairstyle, perfumes, height, and jewelry. Many questions remain about this disorder. Efforts to understand it and find ways to treat it are ongoing.